Today, we are going to talk about stigma against people with psychiatric disorders. So, what is stigma? Basically, stigma is a fancy word that we use to mean discrimination, prejudice, a negative attitude towards those people who have mental health problems. I will give you an example. So let's say that there is someone who is dealing with depression, and I start thinking, actually, he's not depressed, he's just lazy. Or let's say that depression is something that only weak people have. So those negative thoughts, they are what we call stigma. And the issue is that stigma is very common in psychiatry. People have stigma against people with depression, patients with anxiety, patients with autism, patients with schizophrenia, patients dealing with alcohol or substance use disorders. So, this is very prevalent and frequent in psychiatry. What's the big problem here is that people do not seek care because of stigma. If I know that my brother, my friend, my boss will think negatively about me if they know that I have a psychiatric problem, I will not go to a psychiatrist. I will just try to hide it as much as I can. So, as a result, people don't seek help, people tend to get worse. So look at these statistics. Only 44% of the patients with psychiatric problems, they seek help. 44%. That means that less than half of the patients, they seek some sort of help, a psychiatrist, a psychologist, or any other help that's available. I already shared with you that I had two depressive episodes. The second one was quite severe, and I sought help. I took medication, I did psychotherapy, I did some lifestyle changes, and I got better. And this is what I see with the vast majority of my patients with depression. They go to care, we treat them. Sometimes we try one medication, we need to try a second one. And if they seek care and if they have persistence, most of them they improve. And on top of that, psychiatry is really advancing. There are a lot of new things, a lot of new treatments that we can give to patients. And stigma, it's a major barrier between the progress the psychiatry is having and treatment seeking behavior because people don't get to the psychiatrist, so they cannot benefit from this progress. So, what I am proposing here is for us to think about psychiatric problems just like any kind of other medical problem. For example, heart problems, kidney problems, bone problems. Why we don't see psychiatric problems as a medical problem that happens, that are common, and that we need to have an empathic, a supportive approach so they can seek help and they can improve. So, those were my thoughts about stigma, and thank you so much.